Hello YouTube, it's me again, Veronica Yancey, and today this evening I'm going to make a video about vital signs. I felt the need to make this video because I am a healthcare professional and have been so for the past 14 years, and I think it is very important that everyone knows the importance of vital signs. If you have a heart, if you are breathing and you're living, it's quite important for you to know, how to do vital signs. So this first video will be more so dealing with blood pressure. And I am going to use my daughter's insulin as like my patient, but there are a few things that I want to explain before I actually perform the vital signs. Vital signs basically is a measurement of your vitality, if to put it simple. There are several ways that you can obtain vital signs. One is blood pressure. The other is respirations. Another one is your O2 saturation levels, your pulse, and your temperature. Like I said, this video is more so about blood pressure. Now, in order to obtain your blood pressure, you have to have two tools or two items. The first item is a stethoscope. Okay, a stethoscope is basically a scope that listens to, well, you can use it for several things, like listening to your blood pressure through your veins or your arteries. And other one is you can also use this to listen to your heart. This is more so for doctors or physicians. And you can also listen to breathing through a stethoscope. But again, we're going to use this for blood pressure, which is in my scope of practice. The next tool is going to be the blood pressure cuff. Yes, this is the blood pressure cuff. It's also known as the sphygmanometer. Yeah, it's a kind of funny name, but we just call it a blood pressure cuff. Now, one thing you need to know about a blood pressure cuff is that blood pressure cuffs come in various sizes, ranging from extra small to extra large. Extra small being for children as well as small adults. Of course, anywhere from an adult normal or regular size cuff to an extra large cuff, larger cuffs being for larger people with larger arms. This particular blood pressure cuff is a standard adult cuff. This is pretty much the only one that I have. This is my personal cuff. Because I don't have an adult, I'm the only adult right now, I'm going to use my daughter as an example. But let it be known that the cuff size really do matter. To get an accurate blood pressure, you really need the right cuff. So give me 1 second. Oops. Okay, I'm back. So before I actually show you how to do a blood pressure vital sign, there's some important things I want to tell you. Blood pressure is measured by two numbers. The first number is the systolic number and the diastolic number. Or other words, the systolic pressure or the diastolic pressure. The systolic pressure is the amount of pressure that is in the arteries during the contraction of your heart muscle. And the diastolic number or diastolic pressure is the pressure in your heart muscle between the beats of your heart. So these two are very important. And this is what you listen for when you are taking a blood pressure. Now, of course, I cannot, you cannot hear me taking a blood pressure, but I will just go through the motions to show you what, how to go about taking a blood pressure. Numbers matter. An adult normal blood pressure range is 120/80. That's a normal range. For an adult, a high range, a high range is anywhere between 140 and 90 and above. 140 plus over 90 plus. And hypertensive blood pressure would be measured if the numbers are 180 plus over 120 plus. So these are things I feel like you should know. Okay. Also, the reading that you get from a blood pressure can also depend on the position that the person is in when the blood pressure is being taken. Like, for example, we have 3 standard positions that we take blood pressure in. One is the standing position, where you're standing straight up. Okay. And the second one is the seating position, or also known as the Fowler's position. Semi-Fowler's position. It's kind of when you're laying in a bed, but you're laying at an angle. That's what we call a semi-Fowler's position. And the last position is known as the supine position, which means basically that you're lying down flat. Now, the flatter you are, the lower the numbers is going to be. So, okay, so also wanted to mention a child's normal blood pressure range is 80/50. And depending on, let's say, the clinic or the facility, they may have different ranges depending on the child's age. But anywhere between 80/50 is what is considered to be a normal child range blood pressure. Let me see, what else did I have? Let's see. Yeah, I think I went over everything when it comes to blood pressure. Now, one thing you want to do is when you're measuring blood pressure, I would recommend that people get very familiar with the sphygmomanometer. This is what this is right here. Okay, and it has numbers, and the numbers are measured in 20 increments. So 20 being the lowest and the highest being 300. Okay, now, usually when you inflate a blood pressure cuff, you want to pump it up to anywhere between 180 and 200. Okay, and then you deflate slowly. And while you're deflating, you have to listen for the first and the last beat. The first beat will be considered the systolic number, and the last beat will be considered the diastolic number. You're not going to always get, well, like when you're doing, let's say, an adult, you're not going to always get the normal blood pressure range, which is 120/80. You may get something like 142/68, something like that. That's okay. But like I said, if you are into taking blood pressures, you want to get very familiar with this sphygmomanometer. Okay. And learn, it's just like, when you got a watch or something and you have to learn that, okay, to read between the numbers. Same thing with this. And the numbers, which is not shown on the sphygmomanometer, the little lines between each number is a measurement of twos. Okay. So anyway, now I'm going to show you how to apply the cuff. And again, this is an adult cuff. And due to the fact that there is no other adult here, I use my child as an example. Now, you want to make sure that you put the cuff on the right side. Now, this right here, where you see that Velcro type material, this would be laying flush to your arm this way. Okay, like laying it on top. Not every cuff comes equipped with this little thing right here, but this is normally where the sphygmomanometer is clipped. So you want to have this going face up. Okay, you want to put on the cuff. Is this a like? Yes. I'm going to slide up and I need you to come a little bit over because we want to get into camera view. Okay. I need you to hold your arm out. Now you always have your arm facing up with your hand facing up towards the ceiling. Okay. You want to align. There's some cuffs come with like this line that shows you where to place the cuff, but you want to place it, over the artery. And because our arm is so small, hold your arm up so they can see. Okay. You want to kind of get it as taut to the arm as possible. Have the patient relax their arm. And again, this little neat little thing is where you can clip on the sphygmomanometer. But again, you don't necessarily have to put it there. A lot of times I'll just lay it flat in front of me. Okay. As you can see, Zenzele is sitting in the phallus position, in the sitting position, like at a 90-degree angle. Okay, this is the seated position. And a lot of times if you work in healthcare, you have to chart, the position that the patient or the resident is positioned in. Also, it matters like if the left arm or the right arm. Normally, people would try to go, a healthcare professional would place the cuff on the left arm because it's close to the heart. But just for the sake of showing you how to do a blood pressure, we're just putting it on her right arm. And again, I don't know if you can see, the cuff is on her arm and it's fitted. There's going to be some flat land, but you just kind of fold that in. And just have the patient relax. Okay. This thing right here is called the bulb. And there's a, oh yeah, I forgot. Okay, here we go. This thing right here, there's a dial on it. And this dial, you have to, and this is what I remember from childhood. Righty-tighty, lefty-loosey. So when you want to inflate, you have to turn it to the right. Okay? And you want to tighten it up. Okay, this is to get ready to inflate the cuff. At this point, you want to place your stethoscope in your ears. Or, yeah, you want to place the earpieces in your ears. You want to make sure that this thing, it turns. Not every Um, Not every stethoscope has this option, but you want to make sure that it is turned to the bell where you're going to use. This thing is called the bell anyway. So you want to be able to hear through this. And by the way, this is a Littman stethoscope. This is what I prefer and also recommend, but really at the end of the day, you choose whatever stethoscope that you want. Now, you want to place the bell directly over the artery or the vein of the arm. You don't want to put your fingers on top. You kind of want to put it to the side because you don't want to hear your movement, the movement of your fingers. So you just place it over there and simply inflate. And you want to inflate, and I'm making an example. You don't want to hold this for a long time because it's tight, but you want to have it up to 200. And I don't know if you can see this from here, but yeah, 200 or 180. And you want to slowly release and listen. And the reading that I got was 90/62. This is Zenzalay's blood pressure. A lot of times I've seen people that they don't actually hear a beat, and they might measure it by the movement of the dial in this thing, and that is the wrong way. You want to listen. After you get the blood pressure, I usually chart to memorize. So 90/62 was her blood pressure reading. And one important thing that you want to do is take the standard precautions by always cleaning off your equipment with alcohol preps. And thank you, Zenzalay. I appreciate you for being my patient. You want to clean off the earpieces each and every time that you do perform blood pressure, because sometimes these things can gain build up. I personally take a separate one and then just wipe down the rest. That way you prevent passing on any type of germs or viruses or whatever. So just take it and just wipe it down, and then wipe off the bell. Normally we don't wear gloves when we perform vitals, simply because it's not an invasive procedure. So that pretty much concludes on taking blood pressure measurements. If you have any questions, please leave them below in the comment section. And the next thing we're going to discuss when it comes to vitals is this handy dandy pulse ox machine. This pulse ox machine fits on your finger, and it measures your pulse and your O2 saturation, or the oxygen in your blood. Then we have a thermometer. And then you also want to measure respirations. There's no fancy tool except if you're in a hospital and you're hooked up to a monitor. But respirations are usually measured by just watching the chest rise and fall. But that's for a whole nother video. Thank you for taking the time to watch, and I hope you learned something. If you have any questions, feel free to ask. Again, I just want to state for the record, I am not a physician. I am not a doctor, but I am a healthcare professional with 14 years experience. So I hope you enjoy, and please do not forget to subscribe to my YouTube channel, as well as hitting the button for the bell for notifications, and feel free to share. Thank you.